Hi, I'm just going to start off by performing hand hygiene and verifying the healthcare provider's order. So once I've confirmed the healthcare provider's order, I'm just going to take a look at my MAR here for Ryan Nauer, date of birth 5/1/51. He is allergic to aspirin and Tylenol, and we are not giving him either of those, so it's okay to give. He's currently complaining of pain, so we're going to give him a meperidine injection of 20 milligrams. And I'm also going to note that there was a 24-hour med check by the RN Mighty Mouse. So first, I'm just going to get my supplies. I'm going to pull out Ryan Nauer's drawer and grab meperidine 50 milligrams per 1 milliliter, and it is not expired. Expires 12/20/30. I'm going to get a 22 gauge 1.5 inch needle. It is unopened, intact, not expired, therefore it is sterile. And I'm going to get a 3 milliliter syringe, also unopened, intact, not expired, therefore it's stable too. So now that I've got my supplies, I'm going to do some med math. So prescribed was 20 milligrams, and the concentration in the vial is 50 milligrams per 1 milliliter. And that yields 0.4 milliliters. I'm going to do my med math a second time just to double check. So again, prescribed was 20 milligrams. The dosage in the vial, or the concentration in the vial, is 50 milligrams per 1 milliliter, which again yields 0.4 milliliters. So with 2 med math checks, I can confirm that I will give him 0.4 milliliters. So now that I've done that, I'm going to do my first med check. So this is for the patient Ryan Nauer. We've got Ryan Nauer on the MAR. He is allergic to aspirin and Tylenol. We are giving him meperidine, so that is good to give. Again, it's a meperidine injection. Right here I've got meperidine, 50 milligrams per 1 milliliter, not expired, so we can give it to him. It's a 20 milligram order, and through 2 med mass that yields 0.4 milliliters, so that is the dosage. It's an as needed medication. He hasn't received it in the past 4 hours, and it is an every 4-hour medication, therefore it's okay to give. It is 11 o'clock right now, so it's going to be an 11 o'clock medication, and it's an IM injection, and we've got supplies here for an IM injection, and it's going to be in the right ventral gluteal area. So now I'm going to move right outside the patient's room. I'm going to prepare the medication and create a label. I'm going to clean off the top of the vial. Since I'm going to give him 0.4 milliliters of medication, I am going to pump up 0.4 milliliters of air into the syringe. Right. I'm going to inject to the vial. I'm going to inject the air into the vial, and then I'm going to pull back 0.4 milliliters of medication. I'm going to create a label. So this is for my patient Ryan Nauer. The medication is meperidine, 50 milligrams per 1 milliliter. What was ordered is 20 milligrams, which yields 0.4 milliliters. And the date is February 9th, 2020. The time is 11 o'clock. And my initials. Alrighty, now I'm going to do my second med check. So it is for the patient Ryan Nauer right here. We've got Ryan Nauer on the MAR, Ryan Nauer on the syringe. He's allergic to aspirin and Tylenol. We're not giving him aspirin or Tylenol, so that's good. We're giving him a meperidine injection. That's what we've got on the MAR. That's what we've got in the syringe because we took it out of this vial, which has meperidine in it. The dosage is 20 milligrams, which yields 0.4 milliliters, and that's what we have in the syringe. It's an as-needed medication to be given every 4 hours. He hasn't received it in the last 4 hours, so it's okay to give. We're going to give it to him at 11 o'clock. And then it's an IM injection. We've got the supplies here for an IM injection, and it's going to be a right ventrogluteal injection. So now that I've done my second med check, I am going to enter the patient's room. Hello, Mr. Nauer. My name is Hannah. I'm going to be your nurse today. I'm going to wash my hands and provide privacy. I'm just going to be here to give you an injection for your pain. Is that okay with you? He says it's okay. Alrighty, I'm just going to ask you for your name and date of birth. He says Ryan Nauer, 5151. I'm going to compare that to the MAR. So Ryan Nauer on the MAR, Ryan Nauer on the name badge, 5151, 5151. Also the patient IDs, 402, 70, 2676, align. So that is good. All right, I'm gonna just ask you a few questions. Can you tell me where you are right now? He says College of Nursing, 4th Floor Lab. Can you tell me what holiday is coming up? He says Valentine's Day. And then can you tell me if you're allergic to anything? He says aspirin and Tylenol, and we are not giving him either of those, so the medication is good to give. Now I'm just going to do my third and final med check here at the bedside. So we've got Ryan Nauer. We've got Ryan Nauer right here on his wristband, on the syringe, and on the MAR. We've got the medication meperidine. We've got meperidine on the MAR, meperidine in the syringe. It is a 20 milligram order, and we've got 20 milligrams per 0.4 milliliters in the syringe, so it's the correct dosage. It is an as-needed medication to be prescribed every 4 hours. He hasn't had it in the last 4 hours, so it's okay to give. We're going to give it to him at 11 o'clock, and then it is an IM injection, so it's going to be given in the right ventrogluteal area. And we've got the supplies necessary for an IM injection, so that is okay. Alrighty, so I'm just gonna wash my hands, put on gloves. So now I'm just going to raise the bed rail, raise the bed to a comfortable height, lower the bed rail closest to me. I'm going to help my patient roll over. I'm going to inspect the skin. There's no swelling, lesions, wounds, anything that would mean that we couldn't give the injection there. So we are going to give the injection here. So I'm going to find the greater trochanter. I'm going to palm the greater trochanter. I'm going to point my thumb to the belly button. I'm going to lay my index finger on the anterior iliac spine, and I'm going to put my middle finger on the iliac crest, and the injection is going to go right in between those two fingers. So I'm going to open an alcohol swab, greater trochanter. I'm just going to clean right here. I'm going to lay that there. Going to prepare my injection. So I'm going to pull the skin taut so that I can administer it at a 90-degree angle. I'm gonna hold it like a dart. 1, 2, 3, stabilize, steadily inject, remove my fingers, remove the syringe, activate the safety. If there's any bleeding, I'm gonna dab. I'm gonna help my patient roll over. I'm going to discard this into the sharps. All right, so then I'm going to raise the bed rail, lower the bed rail. I'm going to get my patient anything extra they need, give them their call light, make sure they're okay. I'm going to discard my gloves and provide hand hygiene one more time. And then once I've given him everything, make sure he's comfortable, I'm going to throw away my supplies and I'm going to walk outside and document. So I'm going to document the date, 2/9/2020. I'm going to initial and sign at the top. I gave it to him at 11 o'clock in the right ventrogluteal area. I'm going to initial, and then there's my documentation.